Hi, Dr. Yass here. I'd like to discuss what I believe is a critical transformation that's going to have to occur for people that are in chronic pain. And it's in regards to an understanding of the causation of the pain. And the only way that you're ever going to get beyond suffering chronic pain indefinitely is that you're going to have to begin to recognize that for the past 40 years, there has been a certain language that's been associated with the issue of chronic pain. And that basically relates to the idea, the language evolves around the idea that diagnostic tests such as x-rays or MRIs finds the cause of pain because a structural abnormality is identified at the time of the pain and therefore asserted to be the cause. Structural abnormalities then become the basis of diagnosis, and all treatments that follow are designed to address these structural abnormalities. And this has been the basis, regardless of whether you're talking about the spine or peripheral joints. We're basically looking at herniated discs, arthritis, stenosis, meniscal tears, labral tears, all these types of structural abnormalities. And for the past 40 years, this has been the basic language of how chronic pain is diagnosed and treated. And it doesn't take anybody very far to realize that it's not a very successful mechanism. That in fact, there's still 140 million Americans, 1 billion people worldwide suffering from chronic pain. The numbers have never gone down, they've only gone up. You've had an opioid epidemic. The numbers of people committing suicide have increased, depression increased, loss of productivity in work has increased, all associated with this 40-year bout of chronic pain. What I need people to understand and what I'm trying to convey to them as a singular guy who has figured this out over the past 30 years is that a new language must be understood. You must begin to look at your chronic pain from this type of language, the language of the Yass method. And that language says that diagnostic testing is not the answer, but in fact, the interpretation of the body's presentation of symptoms is the way of identifying the tissue in distress, or in fact, the cause of your symptoms. So the Yass method separates itself from all others by using this different language. And that language says that to identify what tissue is in distress, you must interpret the body's presentation of symptoms because every tissue creates a specific symptom, and all symptoms are created by specific tissues. So if you could interpret the symptoms, you could interpret what tissue is in distress. The Yass method has shown that in more than 98% of cases, the cause of pain is muscular, even though structural abnormalities are identified on MRI or X-ray. We simply disregard those as independent variables. They have nothing to do with the cause of your symptoms. So 98% of cases, the cause of pain is muscular. And what this does is it allows you to identify which particular muscles are not at a level of strength that is equivalent to the force requirement of your activities, which is why they're straining and eliciting your symptoms. And it has been shown that it doesn't take more than 3 to 4 muscles to be in distress to affect your capacity to function optimally and to be able to do that pain free. And so there's just a series of exercises that are required, incorporating progressive resistance, which is the basis by which muscles are forced to adapt to greater resistances until their force outputs are greater than the force requirement of activity. This is all basically singular to the Yass method, and it only takes weeks for this strength development to be achieved to where the force output of all the muscles is greater than the force requirement of your activity, and therefore you are pain-free and fully functional. So, across the board globally, whether your pain is from head to toe, either you decide that you're going to look at this new language, you're going to go away from the old language, which is diagnostic testing, structural abnormalities, treat them infinitum, and suffer whatever is provided for you, or look to this new Yass method language, which says that diagnostic testing is not the solution, that in fact, the interpretation of the body's presentation of symptoms, which is the Hippocratic method, by the way. Hippocrates himself is the one who said this is the basis by which all diagnoses should be derived. But that, in fact, the Yass method is shown in more than 98% of cases the cause of pain is muscular. 3 to 4 exercises performed 3 times a week, incorporating progressive resistance exercise, allows you to be fully pain-free and fully functional in weeks. This is your choice. Old language, new language. Indefinite pain, pain resolution, full function in weeks. It's your choice. If you like this video and it makes sense to you and is helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and hit the bell icon to get notifications when new videos are added or when I'm live on YouTube. If you would like to email me, you could do so at drmitch@mitchellyass.com. If you would like to schedule a Yass method treatment session, simply go to www.livewithoutpains, that's plural, livewithoutpains.com, and you'll be able to schedule a session for the day and time that works best for you. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.